Cervicogenic headache, often abbreviated as CGH, is a type of secondary headache that actually starts in the neck but is felt in the head. Unlike migraines or tension headaches, CGH is caused by problems in the cervical spine, especially the upper neck joints and nerves. Many people with CGH describe a steady non-throbbing pain on one side of the head that begins in the neck and radiates forward, sometimes reaching the forehead or around the eye. This condition is common, especially after neck injuries like whiplash, and can be quite disabling. Understanding CGH is important because it often overlaps with other headache types, making diagnosis tricky. In this video, we'll break down how CGH develops, how it's diagnosed, and what treatment options are available so you can better understand this complex condition. Root cause of cervicogenic headache lies in the anatomy and nerve connections of the upper neck. The upper cervical nerves C1, C3, and their connections with the trigeminal nerve in the brainstem create a pathway where pain from the neck is misinterpreted as coming from the head or face. For example, dysfunction in the C2-3 facet joint, often due to arthritis or injury, can send pain signals that the brain perceives as a headache. The structures like the atlantoaxial joint or irritated muscles can also trigger CGH. This is why neck pain, limited neck movement, and headaches often go hand in hand. Understanding these nerve pathways helps doctors pinpoint the source of pain and guides both diagnosis and treatment. Recognizing the link between neck dysfunction and headache is key to managing CGH effectively. Diagnosing cervicogenic headache can be challenging because its symptoms often overlap with migraines and tension-type headaches. Doctors start by taking a detailed history, looking for headaches that start in the neck and stay on one side, often triggered by neck movement or posture. Physical examination is crucial. Clinicians check for neck stiffness, muscle tightness, and tenderness in the upper cervical joints. Special tests like the cervical flexion rotation test help identify restricted movement at the C1-C2 joint. Imaging such as MRI or CT scans may be used to rule out other causes, but they rarely confirm CGH on their own. Diagnostic nerve blocks, where pain-relieving medication is injected near suspected nerves or joints, can provide strong evidence if the headache disappears. This stepwise approach helps ensure an accurate diagnosis and guides the best treatment plan. Treating cervicogenic headache starts with conservative, non-invasive options. Physical therapy is often the first step, focusing on exercises to strengthen deep neck flexors, improve posture, and increase neck mobility. Manual therapy and postural correction can reduce headache frequency and intensity. Medications like NSAIDs or muscle relaxants may help with pain, but long-term use is not recommended. These measures aren't enough. Interventional treatments such as nerve blocks or radiofrequency ablation can target the pain source more directly. In rare severe cases, surgery may be considered, but it's reserved for those who don't respond to other treatments. Each treatment plan is tailored to the individual, aiming to restore function and quality of life. Collaboration between patient and healthcare provider is essential for the best outcome. Cervicogenic headache is a complex but manageable condition that starts in the neck and radiates pain to the head. Its diagnosis relies on a careful combination of history, physical exam, and sometimes diagnostic nerve blocks. While imaging can help rule out other causes, it rarely confirms CGH alone. Treatment usually begins with physical therapy and lifestyle changes, progressing to medications or interventional procedures if needed. Surgery is rarely necessary. The key to effective management is recognizing the neck as the pain source and working closely with healthcare professionals to find the right treatment plan. With the right approach, many people with CGH can achieve significant relief and regain their quality of life.